So the ethamoid bone is divided into three parts. One is the cribriform plate, one is the perpendicular plate, and one is the lateral masses. So this is the cribriform plate, which is a sieve-like bone. It separates the cranial cavity with the nasal cavity. So it has two surfaces. One is the cranial surface, one is the nasal surface. The nasal surface is convex, whereas the cranial surface is concave. And the nasal surface attaches the other two parts, which are the perpendicular plate and the lateral masses. Now, coming to the cranial surface, which is the concave surface, it is divided by crista galli into two parts. One is the ethamoidal fossas for the lodgement of olfactory bulbs of the brain, and therefore it is also known as the olfactory fossas. Then we come to the perpendicular plate. The perpendicular plate is the posterior part of the nasal septum, and the posterior its posterior border is attached to the nasal surface of the cribriform plate, whereas its anterior surface is attached to the cartilage of nasal septum. Its dorsal border is attached to the frontal suture, and its ventral border is attached to the vomer bone ventrally. Then we come to the lateral masses. The lateral masses is divided into two parts. One is the left and right, and each lateral mass is bounded on lateral side by a curved plate of bone called the lamina lateralis, and the lamina lateralis contains of various scrolling like thin plate of bones known as the ethamoid turbinates. So the ethamoid turbinates along with the lamina lateralis forms the lateral masses, and the space between these ethamoidal turbinates are known as the ethamoidal sinuses or the meatuses, and these are lined by the olfactory mucosa.